Hello everyone, my name is Lan-Hsin. Just briefly about myself. I graduated from the University of Melbourne in 2011, worked in general practice for a couple years in Australia before I started a small animal rotating internship at Mississippi State University in the US. After completion of the internship, I returned to my hometown in Taiwan and helped starting a small animal practice. I came back to Melbourne last year and started working in an emergency hospital. I then obtained my membership in feline medicine in July this year. I started a general club in Mandarin, and this presentation was meant to be for vets in Taiwan, so I hope it won't be too easy or boring for you guys. This paper is from the August JFMS. The reason I chose this article is not because it has good experimental design or great discovery, but there is something we could discuss and apply to our daily practice. This article is mainly looking into the analgesic effects of oral gabapentin in OHE surgery. Gabapentin is a lipophilic structural analog of the inhibitory neurotransmitter GABA. It has been used for the treatment of seizure and neuropathic pain. Its mechanism of function is unknown, but it involves interaction with voltage-gated calcium channels. The drug has high bioavailability after oral administration in cats, which is a potential favorable characteristic for an analgesic drug. The primary objective of this study was to evaluate the analgesic effects of oral gabapentin in combination with buprenorphine, and to compare these effects with those of a meloxicam and buprenorphine group, or buprenorphine alone group, in client-owned cats undergoing OHE. A secondary objective was to evaluate the correlation between two pain scoring systems in cats. The UNESP Botucatu multidimensional composite pain scale has been validated for assessing post-op pain in cats both in English and in French. The Glasgow Composite Measure Pain Scale was developed for assessing acute pain in cats. Individuals were included in the study if they were considered healthy based on medical history, complete physical exam, and hematocrit and total protein testing. Exclusion criteria included aggression, cardiac dysrhythmia, pregnancy, lactation, obesity, which is body condition score greater than 7 on a scale from 1 to 9, anemia, which is hematocrit less than or equal to 30%, and clinical signs of disease. Individual treatment randomization was performed before the study had begun using a software by 2 individuals who were not involved with treatment administration. There were 3 treatment groups. The first one, GBG, involved treatment of gabapentin and buprenorphine. The cats in this group were administered a 50 mg gabapentin capsule 12 and 1 hour prior to OHE surgery. The cats were premedicated with acepromazine 0.02 mg/kg and buprenorphine 0.02 mg/kg as a single injection into the lumbar apexial muscles. In second group, MBG, which was meloxicam and buprenorphine group, the cats were administered a capsule containing lactose 12 and 1 hour prior to the surgery. Premedication was the same. They then received meloxicam 0.2 mg/kg subcutaneously immediately after induction of anesthesia. The third group, BG, is buprenorphine only group. The cats received the lactose capsules at the same time and received the same premedication. The picture showed the timelines of all the events. 12 hours and 1 hour prior to OHE surgery, the cats received the oral capsules, then premedication. 20 minutes later, placed IV catheter, induction with propofol, intubation, and maintained on ISO in oxygen. The MBG cats received a dose of meloxicam sub-Q immediately after induction. LRS was administered at the rate of 5 ml/kg per hour. 1 veterinarian with experience in surgery performed OHE. Evaluation was performed before premedication, which was approximately 60 minutes prior to the induction of anesthesia, which was baseline, and at 0.5, 1, 2, 3, 4, 6, and 8 hours after the end of surgery by an observer who were unaware of treatment administration. Evaluation included sedation by using a Dynamic and Interactive Visual Analog Scale, DIVAS, and the two-pen scale system mentioned before. The need for rescue analgesia was considered the primary outcome of the study and was based on the UNESP Botucatu MCPS when its scores were greater than or equal to 6. 52 cats were included in the final analysis. So first, let's have a look how many cats required rescue analgesia. 16 cats required rescue analgesia. Prevalence of rescue analgesia, as shown in Table 2, was not different using the MCPS. Time to first rescue analgesia was not different among treatments. The prevalence of rescue analgesia would have been significantly different among treatments if the intervention had been based on the Glasgow Feline Composite Measure Pen Scale greater than or equal to 4. The prevalence would have been higher in the BG group than the GBG and MBG groups. The Spearman's rank correlation indicated a strong correlation between the two pen scores. The DIVAS sedation scores were not different among treatments at any of the time point. Sedation scores were increased in all three groups at 0.5 hour when compared with baseline values. The UNESP Botucatu MCPS and the Glasgow CMPS pen scores shown in these two charts were not different among treatments at baseline 0.5, 1, and 2 hour. The MCPS pen scores were increased for the GBG and BG treatments at 1 hour and 2 hour when compared with baseline value. The Glasgow CMPS pen scores were increased for the GBG at 0.5 hour and 1 hour when compared with baseline values. The result of this study showed that post-op pen scores and prevalence of rescue analgesia were not significantly different among treatments using the MCPS. The limitation of this study included small sample size, pen scale systems in different languages, and the relatively inexperienced observer for pen assessment. They did emphasize that prevalence of rescue analgesia would have been significantly lower in the GBG and MBG than BG using the Glasgow CMPS. And analgesic effects in the GBG were not different than MBG using either pen scores. They concluded that gabapentin could be an alternative for post-op pen or as part of multimodal analgesic regimen, particularly when NSAID are contraindicated. How can we use this information in our daily practice? I believe most people know that we can ask owner to administer gabapentin at home before coming to the clinic to those cats that are very nervous or difficult to handle in the clinic. The current recommendation is to give one dose the night before vet visit and another dose 1 hour prior to vet visit. The dose of gabapentin used in cats are shown here, usually depending on the general health of the cat, its weight, and personality. It can also be used as pain relief for post-op pain, post-dental, neuropathic pain such as feline hyperesthesia syndrome, etc. In this month's JFMS, there is another article discussing the analgesic effects of transmucosal buprenorphine in cats with oral disease, mainly gingival stomatitis. The dosage used currently is 0.02 mg/kg transmucosa. The systemic absorption of buprenorphine after buccal administration depends on the mucosal pH. Buprenorphine is a weak base. Healthy cat's oral cavity has a pH between 8 and 9, favors this unionized form and enhances its bioavailability. The cats in this study had a buccal pH of 8.5 to 9.1. Transmucosal buprenorphine seemed working in these cats with gingival stomatitis, however, potentially with slightly lower bioavailability when compared to healthy cats. But this may also be influenced by the easiness of administration. The result from this study may also suggest that the duration of effect of buprenorphine at current dose may be shorter than previously reported, perhaps need to be given more frequently than every 6 hours. There are many different pen scale systems. Here are a few common ones. It is encouraged to implement one pen scale system in your clinic for evaluation of in-hospital patients, post-op patients, etc. Hopefully this presentation brought some information to you, and thank you for listening.